Hippocrates was an early practitioner who felt that the patient should have all of their body fluids in sync. This is especially true of yellow and black bile. Benjamin Rush was a humanist and believed in bloodletting. He was the father of American psychiatry. The first mental hospital was established in the 18th century. Maslow would attribute the loss of a pet to the love and belonging stage. Dorothea Dix's contribution to mental health was creation of state hospitals for mental health care, 19th century system of state asylums, and system of asylums was introduced to mental health. Linda Richards' contribution to mental health, the first American psychiatric nurse, and she opened the first training school for nurses in 1882. Changes in mental health in the 1960s. The beginning of deinstitutionalization happened in the 1960s. Therapeutic care reverted to custodial care in state hospitals, which provided the largest resource for individuals with mental illness until the initiation of the community health movement. It also took patients from asylums to communities. 1950s mental health. Thorazine discovered to help control behaviors and improve clear thinking. And there were 600,000 residents were in mental institutions. Somatic therapy is insulin shock. ECT is electrical stimulus to the brain. Why did we deinstitutionalize? The discharge of patients from state mental hospitals back to their original community. This was initiated for three main reasons. One was belief that treatment in hospitals was inhumane. Two was hope that medications would offer a cure. And three, lack of funding at the state and federal levels. Hildegard Pepperlaw developed interpersonal relationships. Freud's theory of mental illness was that it's strictly biological. World War II influence on mental health. The government passed the National Mental Health Act of 1946 and the increase in graduate level education in psychiatric nurses. Stigma and mental health. It's a negative attitude and beliefs towards people who have a mental health condition. Defense mechanisms. Conversion. This is where a woman becomes blind after seeing a young boy killed by a car. Intellectualization. After the death of her husband, the widow stays busy planning all the funeral arrangements without taking time to feel sadness or grief. Reaction formation. Recovering alcoholic constantly preaches about the evils of alcohol. Suppression. A woman feels a lump in her breast right before her 2-week cruise and puts the information in the back of her mind until after she gets back from vacation. Compensation. A man drinks excessive amounts of alcohol, but then eats a healthy diet and exercises regularly to compensate. Repression. A woman unable to enjoy sex after having pushed out of awareness of sexual assault from childhood. Displacement. Patient yells at the nurse after his family does not visit. Disassociation. A man starts daydreaming as he is driving down the road and realizes that he missed his exit a mile later. Denial. Widower whose wife dies 2 years earlier has all her clothes in the closets and talks about her in present tense. Regression. Patient brings home a new baby brother and the 4-year-old starts sucking his thumb again and cries for a bottle. Identification. A teenager wears the same haircut and clothing style of a popular rock musician. Undoing. After flirting with her male secretary, the woman buys her husband tickets to a ball game. Altruism. Providing the care for a relative with a chronic illness. Sublimation. Going to the gym to work out after getting very angry at the boss. Projection. Man unconsciously attracted to the other women tease his wife about her flirting with other men. Rationalization. I didn't get the promotion because the boss doesn't like me. NAMI is National Alliance on Mental Illness. It's the grassroots organization. The aims of acute care was used to stabilization for patients with mental illnesses. Forensic nursing is the intersection of nursing and the criminal justice system to provide nursing care to victims. ADA. Mental illness was added to the list of disabilities under ADA in 1990s. Levels of prevention and their impact on mental health. Primary. Services aimed at reducing the incidence of mental disorders within the population. The primary prevention targets both individuals and the environment. The emphasis is twofold. For example, providing education and support to unemployed or homeless individuals, teaching concepts of mental health to various groups within the community, and teaching techniques of stress management to anyone who desires to learn. Secondary. Interventions aimed at minimizing early symptoms of psychiatric illness and directed towards reducing the prevalence and duration of the illness. This, for example, accomplished through early identification of problems and prompt initiation of effective treatments. This would be ongoing assessment of individuals at high risk for illness exacerbation, provision of care for individuals whom illness symptoms have been assessed, and referral for treatment for individuals in whom symptoms have been assessed. Tertiary. Services directed at reducing the residual defects associated with several persistent mental illnesses. For example, preventing complications of the illness and promoting rehabilitation directed towards the achievement of individuals, the maximum level of functioning. The definition of mental health and mental illness. Mental health is the state of emotional, psychological well-being that can be demonstrated as satisfying interpersonal relationships, effective behavior, and coping, positive self-concept, and emotional liability. This is how you handle stress. Mental illness is a health condition involving changes in emotion, thinking, or behavior, or a combination of these, often associated with distress and/or problems functioning in social, work, or family activities. And the first nursing school opened in 1882. ECT signs, symptoms, and usage. It's for major depression. The side effects include confusion, headache, and short-term memory loss. The patient can refuse up to the last minute, even if consent was signed. Side effects for Thorazine, Haldol, and first-generation antipsychotics. Thorazine is chlorpromazine, and it's an antipsychotic. It masks lithium toxicity. Haldol is haloperidol, which is an antipsychotic, and it's used for stimulant intoxication and delirium. The first-generation antipsychotics provide relief of psychosis, improvement in positive symptoms, worsening of negative symptoms. Signs and symptoms of alcohol withdrawal. Diazepam and other benzodiazepines may be administered to ease withdrawal. You offer the 12-step program, group therapy, and family therapy. Treatment for phobias. You score using the Hamilton Anxiety Rating Scale. It's a short-term goal, which is to discuss the phobia, and the long-term goal is to function in presence in the phobia. Therapeutic milieu is an organized set of information given to the patient to start off therapeutic relationship. It's a structured environment that creates a safe, secure place for people who are in therapy. Safety is the number one issue. It's a number one priority. It's no proper exits, back to the wall, etc. Door is always behind you. Never play into the delusions. Psychosis, thought disturbances. Reality testing is impaired and resulting in delusions, hallucinations, and disorganized speech. Therapeutic communication. This is the nurse-client relationship, and therapeutic communication was added in the curriculum in 1955. Up to 90% of the communication is nonverbal. Therapeutic relationship. This is the rapport, the initial task. Trust. This develops slowly. Respect. This is acceptance. And genuineness. This is self-awareness of feelings. Phases and objectives for nurse-client relationship. This is pre-interaction, orientation, which is boundaries are defined and termination is discussed. Working, this is where the nurse assists the client with practicing techniques, offers insight and perception of reality. And termination, this is the end of shift and discharge. Boundaries. Professional boundaries are the space between the nurse's power and the client's vulnerability. Boundaries are set in orientation phase. This is the initial therapeutic milieu. Never share your personal information with clients. It's always going to be safety. If a question asks something and safety is in there, always select safety. Rapport in mental health. This is the desirable outcome for the orientation stage of a nurse-patient relationship development. Focusing is a client tries to change the subject. The nurse states, let's go back to what we were talking about. Reflection. Client states, I get sad because I know I'm going to fail in nursing school. The response by the nurse is reflection. So you start feeling depressed every time a new semester begins? Clarification. A patient discloses several concerns and associated feelings. If the nurse wants to seek clarification, the comment that would be appropriate would be, am I correct in understanding that? Active listening. This is maintaining eye contact, nodding head, smiling or frowning, leaning forward or backward. Stereotypical statements. These are socially shared beliefs that describe a concept in an oversimplified or undifferentiated matter. For example, hang in there, it's for your own good. Or, since you are Jewish, I'll call a rabbi. Or, it'll all work out. Or, wow. Transference. Transference occurs when the person redirects some of their feelings or desires for another person to an entirely different person. This is an example. For example, you remind me of blank. Countertransference. Countertransference can occur when the nurse's emotions may also be displaced onto the patient. That's when the patient reminds the nurse of something. Probing. This is persistent questioning of a client. Non-therapeutic would be, how many times did you receive poor evaluations before you got fired? Offering self. This example would be, I'll sit here with you for a while. Libel. Mood liability is an intense or rapidly changing emotional response that's out of proportion of what is normal. The client has mood swings and is unpredictable. MME is the mini mental examination. The use of restraints. This is chemical and mechanical. A nurse can initiate restraints and medication administration without an order to a patient who is violent. Duty to warn. Mental health professionals must warn potential victims of threats made by a patient. Ethical principles. Autonomy, beneficence, non-maleficence, justice, veracity, and fidelity. Involuntary admission rights. The client enters against his or her will for an indefinite period of time. This is based on the client's need for psychiatric treatment, the risk of harm to self or others, and the inability to provide self-care. This is a Baker Act 52 or a BA 52. Voluntary admission rights. The client or client's guardian chooses admission to a mental facility. A voluntary admitted client may request release at any time. In Florida, this is a Baker Act 40. False imprisonment. The person intentionally and illegally restrains another person's ability to move freely. The nurse put a client in the seclusion room until he admits he started a fight. This would be false imprisonment. Clients in crisis, the type of crisis and the stage of crisis. Phase 1 of crisis, the client is exposed to a stressor and is experiencing increased anxiety. Phase 2 of crisis. The client has been trying to use previous problem-solving skills that don't work and anxiety increases. Phase 3 of crisis. The client used all resources to relieve anxiety related to the stressor. Phase 4 of crisis. Client is at panic level of anxiety and has liable emotions, psychotic thinking. Dispositional crisis is related to external situational stressors like a drunk patient. Maturational crisis is a life-changing event. It occurs as a normal part of the lifespan but causes significant stress. Crisis duration is usually 1 to 3 months.